Hi, Don here. I had a question that someone asked about how to do a wound note. So that's I'm going to share my screen here and show how to do that. This here is a test patient. You can see here. I'm going to start with going through the whole note. This is usually done by the staff, but let's say we take a template right here. You can just pick any one from the previous one, just pulling in the HPI or past medical history, review of systems. There's a normal brief review of systems. And then when we get into the physical exam, the way we do this is with a physical exam template and then a procedure template. So I'm going to share first how to do the physical exam. There are different the saved notes, they pull in the normal values. So for example, there's different types of notes. This is a wound normal note. So it'll pull in kind of the wound information and documentation for wounds. Okay. So this is something it pulls in normal values. So it'll pull in normal pulses, normal integument. And then here is where the wound information pulls up. And it pulls in both the size, kind of what type of wound you're having, and things like that, when the wound began. I think these are all important things. That's called the wound exam. There's also another one that I have in the template. It's called a wound only new. So I want to show that one to you as well. So the wound exam was there. Now, if I put the wound only one, it only pulls in the integument. This is the one that I am using most of the time these days. So what you do is you pull in a patient, and then when you take their normal note and you add this wound only normal. So what you'll see here is right foot, left foot. You'll have the type of wound if it's diabetic, venous, surgical, pressure. Most of these are diabetic ulcers. You're going to put the length, width, and depth in it. So in terms of centimeters, so a lot of times it's smaller than a centimeter. So you might do 0.2 by 0.2 by 0.2. And then you're going to do the depth. Is it the dermis, subcutaneous, muscle, fascia, or bone? Now, these are all just in terms of guiding it based on documentation. The ulcer stage, is it partial, full thickness? So we'll do full thickness. What type of drainage is in there? Is it serous, sanguinous, serosanguinous, or purulent? How much is there? Mild, moderate, or severe? And a lot of times this is necessary for the type of wound dressings that we might dispense in the office. You need something that has moderate drainage daily. If there's a color to it, if there's any odor to it, if there's undermining, if there's any necrosis, and if there's any infection. And then I also put the location. So let's say it's the first med head. Okay. And then the date it began. This is something that I like to do so I can remember when someone comes in. And then I also take the initial size, and many times I'll just copy this size right here, and I'll paste this right in here. Okay. So copy this size and paste it right here. Okay, so that's how I do the wound integument. The rest of the note you can pull in if you want to pull in a previous template. There are a lot of different templates. The most common one I use is foot pain normal. Okay, so it just pulls in foot pain. It pulls in saved findings, so it pulls in all the normal values. So this will just pull in everything else that's in this. Okay, so that's that portion. Then you'll do any documentation in terms of if there's musculoskeletal issues going on with it, and then down to the procedure. So with procedure, there are many different ulcer procedure codes, and they'd be called debridement codes. So what you'll see here is under debridement, there are nail debridement codes, 1 to 5 or 6 to 10. And then there's also skin. So you're going to have debridement of skin and tissue, each additional 20 square centimeters, skin, tissue, muscle, additional 20, and then going down to bone. And depending on the level, it's going to be the same thing. So most of mine are smaller, so I'm going to put this in here. And so this was done on the right first med head. Then you, depending what you use, let's say scalpel and tissue nipper. There was a hyperkeratotic ring or there wasn't, and then devitalized tissue. and then the depth of usually the subcutaneous tissue, and then how many square. So this would be 1 square centimeter. And then what I used on here, betadine, Amerigel wound dressing, or wet to dry. So let's just say I used a betadine. So this is the physical exam portion of the note for an ulcer. It has the physical exam component, and then it also has the procedure component. Now the procedural component, this will also push over if you set it up into your billing tab. So when you go into your billing tab, it'll put it up. Here is my diagnosis and orders. So you're going to have ulcer, and that was an ulcer for the right foot. And then based on this, you can change whatever you'd like to do. This is a non-pressure ulcer, but you can change it to anything else, and you can set that up how you want it. And if there's other bony abnormalities, or if you want to put in a cam boot or a surgical shoe, anything else like that, you can. Something specifically that I use in the office is like this Helix collagen. So that's something easy to put in there. You put in the Helix, this collagen stuff, or any other type of wound dressing that you're going to do as well. You can type in any patient instructions that you have for them. And then what I do in the discussion, I want to show you specifically ulcer new. So ulcer new is right here. And with this talks about the patients here for ulcer care, the estimated duration of treatment. Let's say it's going to be 2 months. The frequency needed, I'm going to see them back every 2 weeks unless there's an infection. I'll see them sooner. There's a good potential to heal. The status is it's a new ulcer. The dressings, I'm going to do either the collagen powder or betadine, whatever I'm going to do. Say I'm going to do betadine. Frequency, they're going to do this daily. The duration requirement, let's say it's going to be 2 months. They're going to offload it with an appropriate shoe, surgical shoe or walking boot. And then if there's an infection, I'll put this in here. If there's visiting nurse, I wasn't going to do that. I did not do any cultures, and the ABIs weren't ordered, and there's no signs of infection. So a lot of times I put things in here and I can just delete it if I don't need it. So for example, I'll leave that in there and I'll delete it. So this is the wound note. And then, for example, this patient, let's say I want them back in 2 weeks to be seen by me. And then I just choose the ulcer follow-up. Okay. And then in terms of DME, there's a dispensing note for DME. So it's right here. Amerigel, let's say you do a wound dispensing. I dispensed 15 grams of this, 15 grams, 15 grams, and that's how it goes. So if you do 15 or 30, it goes right in there. Now, the neat thing is when you pull this over to the billing tab, you do your letter to your doctor and things like that. That's pretty easy. For the billing tab, it's going to pull in for you can do your ENM for this patient, your Helix, your wound debridement code, and the DME, which is the Helix. So all these will kind of be built out, and I can put any additional things that I want in there for the patient. So that's how I do a note for a patient. And then to show you kind of what it looks like, what I can do is I can show the full encounter in summary. And so this is what it's going to look like. Okay, so the actual note's going to look like this. These are just test patients, so it has their medications in here. But the part we really want to look at here is the note for the ulcer. So here it is, HPI, the review systems. Here's the documentation, everything that I put in there. The things that I put in there, they're going to show up bold, so it's going to be easier to see when you're just reviewing the note. The procedure, we talked about dispensing the wound kit and debridement, the assessment and plan, and then the discussion, and then when they're going to see me back. So it's a pretty easy note to do. A lot of it's templated, and then when they come back, you can do new from old, and you can make any modifications that you want specifically in the size of the ulcer. If there's multiple ulcers, you can just do multiple templates. These templates are pretty easy to set up within it, and you can modify the template however you would like. This is how I do mine, and you can do it however you want. You just make these. These end up in the template section of the medical record. So hope this was beneficial. I do have some of these templates if you are interested in getting them under podiatrypracticemastery.com/EMR. So if you go into EMR, you'll get access to all my templates. Basically, this is just a link to a Google Drive account, and in there, even if you I use Athena, but it'll have all these templates that you can use on your own. Even if you don't use Athena, you can just get the wording and things like that. if that helps you. Okay, hopefully that was beneficial. And if you guys have any questions, just post them underneath this video. And until next time. Okay, thanks.